Hello, everybody. Welcome to another Platinum Physical Therapy Facebook Live about runners. Tonight we have one of our physical therapists, our pelvic floor and women's health specialist, Erica Johnson, and Lauren Philbrook, a local Hopkinton runner who runs for the BAA and ran the Olympic marathon trials a few months ago while pregnant. We are waiting on one more. We're waiting on another pregnant runner, Rachel. She's teaching English class in Argentina, or virtually in Argentina at the moment. Oh, there she is. Let me just add her in.
Hi.
Hello.
Hi.
I think we lost Kim.
No.
Oh no.
All right, I'm going to pull up intro stuff since she's not here for the moment.
I'm back.
Oh, good.
Now we have everybody, so I'll go through some intros. Like I said, Erica is one of our PTs in the Hopkinton Clinic at Platinum. She received her bachelor's degrees in dance and exercise science at the University of Massachusetts in Amherst, followed by her doctorate in PT from the University of Massachusetts in Lowell. She's been practicing PT for over 12 years in the areas of pelvic floor, pregnancy and postpartum, orthopedics, sports med, and dance medicine. Erica has a particular interest in helping patients rehab from pregnancy as well as addressing scar pain, and has experience working with patients after pacemaker insertion, post-breast cancer surgeries, hernial lacerations, episiotomies, C-section, abdominal surgeries, hip surgeries, etc. So pretty much she's done it all. In addition to being a physical therapist, Erica danced with a professional contemporary dance company before, during, and after two pregnancies in Boston up until 3 years ago. And next we've got Lauren. Like I said, Lauren earned her BA in Psych from Williams College in 2009 and graduated from Penn State with her PhD in Human Development and Family Studies in 2015. She's currently an assistant professor in the Psychology and Brain Sciences Department at Colgate University in Hamilton, New York. Her areas of specialization are child psych and sleep psych. Lauren grew up in Hopkinton and fell in love with the marathon first as a spectator watching Boston every year. She competed in the 2012 and 2016 marathon trials and ran the first 3 miles of the 2020 trials with Rachel at 33 weeks pregnant. She and her husband, Steve, had their first child, a daughter named Elizabeth, on April 14th. And I think she's here with us.
She is. She's making a little noise.
Lauren is looking forward to making a healthy return to running in the next few weeks and hopefully being back in Boston in 2021 or 2022. Can you guys still hear me?
Yes.
Okay.
Yeah, you're just frozen, but I can hear you.
All right. Yeah, you guys are frozen for me too. And lastly, we have Rachel, who just joined us. Rachel Hyland is an elite runner who competes for the BAA. She ran competitively at Williams with Lauren, where she met her husband, Sean, who's also a runner. Rachel competed at the 2016 Olympic Trials Marathon in LA, finishing in 46th place. She followed that up in 2018 by placing 4th overall at the Boston Marathon. Her personal best is 2:37. In addition to running, Rachel's a passionate educator and coach. She taught Spanish and coached girls cross country and track at Phillips Academy for 8 years. So there's our squad for tonight. To kick us off, Rachel and Lauren, do you guys mind sharing a little bit with us about your journeys leading up to and running the trials while pregnant?
Who should start?
I can start. I'll start. So I wanted to start because a lot of the reason why I decided to do it was.
Can you hear me?
Oh, yeah. Can you not hear me?
I can hear you.
Okay.
Go ahead.
I don't know what happened to Kim. But I can start.
Rachel, can you hear us?
I didn't hear you just now, but now you're back.
All right.
Yeah, I'm happy to share about the training cycle leading up to the trials. I ran right around like the transition between second and third trimester. So for me, running had gone like pretty well up until that point, and I never really planned on running the whole marathon for the Olympic trials, but I had been running really consistently and did a few workouts like through 21 weeks, I think, and then switched over to easy running. And my longest run leading up to the trials had been 21 miles, I think. But then in the month before, I really had to decrease the length of long run. And I think I had done like a 90-minute or 1:45 run, and then ended up running through halfway, so a half marathon at the Olympic trials.
That's incredible.
Mm-hmm.
Yeah.
Yeah, go ahead.
I think so. A lot of the reason why I did the trials was largely because I was convinced by Rachel, like the fact that she was going to be there too, and running pregnant motivated me to want to do it with her. I had been doing, I think at that point, mostly like 6-mile runs a day. Like I gradually did less and less across the pregnancy. And I think at that point I was like, okay, I'm going to get out for 6. So then it was like pretty easy to get to 8 that day. I just did the first loop on like adrenaline and company from Rachel. I was able to run throughout the pregnancy. I just didn't do any real workouts. I did like long runs. Rachel did the Philly Marathon in November, and I did half of it. I did 15 miles as part of that. So I did like some training. I'd gotten up to, I think the farthest I ever did was like 21 miles, around 20 weeks, but I had like come down quite a bit from then and just did like a little bit less each week, basically, till the end. But it was, I mean, just like the coolest experience doing it together. I'm so glad we did. I'm so glad that she was there to convince me and to share that with me. It was unforgettable.
That's awesome. I think we lost Kim.
So I actually can't hear anyone. Like I don't think I heard Lauren speaking, but
so weird.
It is weird. Can you see her, Rachel, or you can't even see her?
Nope.
No.
Oh, you can't see her either?
Nope.
Okay, well, somebody just responded that they can hear us. So hopefully they're hearing all of us versus some of us.
I'm glad. That is good.
I don't know where Kim was going to go after this, so I will. I guess do you guys have any questions to kind of start this off? I know there were some questions that were kind of sent to us from James. And there it is. There's my phone. I know he had sent some questions that some runners had sent over, but I'm curious, do you guys have any questions to start with?
About pregnancy running? Like,
yeah.
Yeah, definitely. I guess like I was so ignorant, and I honestly didn't really do. I'm embarrassed to share this with a physical therapist. Like I didn't do like any stretching or have any kind of plan. Like but I did have pelvic pain, so I just would like do less when it hurt. What are some things that you should be doing to try to reduce that? Like is there a style of running that's better, or like stretches that I should have done in retrospect next time?
Yeah, there's lots of questions around it. And so the thing that I have learned over time is that I think for runners in general, stretching is important, right? Like we all kind of know that on some level, whether we do it or not is a whole other ballgame. But I think during pregnancy, the thing that we have to remember is that our hormone levels with relaxin are so high that our ligaments are so loosey-goosey. And it causes us to have increased mobility across the board. And so as much as stretching is an important thing, the strengthening becomes even more important. So I wouldn't take the stretching out, but usually if a pregnant mom has like a short window of time of like, I have this much time, I would say I'd spend 75% of it doing like your cardio and your strengthening, and then finish off with like some quick cool down stretching. But the biggest thing that a lot of pregnant moms seem to miss is the strengthening component. And most of that is around the pelvic girdle, right? So with like glutes, adductors, and the abdominal wall. And the thing to realize is that a lot of OBs will actually tell you not to do abdominal strengthening, and that's not true. What they're really meaning to say is they don't want you to do crunches, they don't want you doing double leg lifts, and they don't want you doing bicycles. But doing gentle abdominal bracing, like gently contracting the belly muscles, or other abdominal strengthening based exercises are okay. But the other thing that I always caution people to do is to touch base with either a women's health physical therapist or somebody who's comfortable working with pregnant patients, because they can look at how you're doing things. So I've had a lot of pregnant women say, can I do planks? And I say, you know, a lot of women can do planks. Like I did full planks until the end of both of my pregnancies, but by the end, I usually ended up modifying them because I was watching how my belly muscles were coordinating. And so that's the important piece of it, is knowing what to watch for. And so I usually teach people, you know, like make sure you're not getting abdominal tenting while you're doing these exercises. Make sure that you feel like you're not getting, you know, pressure in your low back, or that you're straining your body. And so there are certain things to just kind of watch for as you're doing these things. Does that make sense?
Yeah, it does. So that was one thing I noticed. I stopped doing planks because I was like doing the tenting thing. But so is there a way to avoid that, or something I should have done? Because then I was like, oh, I guess I should stop doing this. But then I didn't do anything else instead.
Yeah.
Is there a way to modify it maybe? So that
yeah,
was okay.
so for some people, just putting their knees down is enough of a modification. For some people, if they're on their hands and then their knees in a modified plank, they'll still get the tenting, but they can maybe do a full plank, but with their hands on their kitchen countertop, or with their forearms on their wall. So you're changing the angle of your body. So the more parallel you are to the floor, the harder it is. But if you slowly increase that angle, the easier it gets. So you just have to kind of keep watching your belly within those angles.
Okay, gotcha.
And that can change week to week, right?
Yeah. That's really helpful. Thank you.
Sure.
So I jumped in because Kim was having some technical difficulties. I know
Hi,
Lauren and Erica, of course. Rachel, hi. I'm Julianne. I'm one of the other PTs. So, you know, again, obviously you guys can kind of guide things along. I'm just pulling up her questions and everything that she had here. Erica, I guess if we're kind of directing in your direction, you know, you kind of talked about the aches and pains stuff. With like any specific to running recommendations, I guess you could make for somebody, like, do you generally kind of dive into that with patients, like when they're coming in, if they're talking about training for something, like do you make any specific recommendations related to that of far as like their mileage and such?
Yeah, so there's lots of questions of like what mileage is appropriate and what's okay. And I feel like there's a lot of unknown and there's not a clear answer, partially because people's bodies tolerate lots of different things. And the interesting thing with pregnancy is that we're basically chasing a running train, and that everybody's hormones are changing in a similar way, like week to week during pregnancy, but the spikes can be very different. And then depending on what people's activities level were before pregnancy, how good they were about strengthening, how good they were about stretching, and then how their body tolerated all of that varies so much on an individual level. And so if somebody were to call me and say, can I do these things? It's really hard for me to have like a very specific kind of cookie cutter approach, because I don't think there is one. And so, you know, I always encourage OBs, like, don't just say no running, just send them into us so that we can look at their mechanics and look at how they're stabilizing themselves and kind of figure out how they're balancing things. And I think there really has to be a close relationship between like running coaches and physical therapists and OBs or midwives or whoever is guiding kind of the labor and delivery, and delineate kind of what makes sense for each person. And so I don't mean to be wishy-washy about it, but I think, you know, the relative blessing of it is that I don't think there's a hard cut answer. And so, you know, a lot of people can do a lot of really cool things. And there, you know, we see women run the Boston Marathon every year. You know, they've got like, you know, 9 months written on their bellies or whatever, and they're hitting like halfway up Heartbreak Hill, and they're just looking amazing. And the number of times that I've watched that in my career, just, it blows my mind. And after going through 2 pregnancies of my own and being an athlete and trying to go through those and just watching these women really just blows my mind, because it's just amazing that somebody can go through that. And so kind of as we were preparing for tonight, I had pulled up some information. And there was a physical therapist who had written a blog about running during her pregnancy, and she had a torn ACL and was running during her pregnancy. And so there was a study that was published in the British Journal of Sports Medicine in 2015 that encouraged running and high impact sports during pregnancy to increase the risk, or to decrease the risk of pelvic girdle pain. And they found that prior to pregnancy, that there was a 14% lower risk of having pelvic pain during pregnancy if people were engaged in these kinds of activities. And so I think that really speaks to the fact that running is actually really preventative in a lot of ways for people to have injuries. And so I think, you know, as much as running gets a bad rap in a lot of ways, I think that we can really applaud runners about like this kind of information coming out, and that they actually do better. And then they were looking at competitive runners, like 70% of competitive runners tend within part of their research found that they continue to run during their pregnancy, but 31% of them continue into the 3rd trimester. So there's a huge kind of like tank in terms of intensity and what people are doing. But within these women, only 3.9% of them actually became injured during pregnancy. So even though they're running, the injury risk was actually really low. And I was surprised by these statistics, which I think, again, is speaking very highly. But they were also looking at breastfeeding. So 84.1% of the women who ran during breastfeeding reported less postpartum depression and no negative impact on breastfeeding. And so I think that's very cool too. And that makes sense, because we know that the risk of postpartum depression is so high, and we know that the endorphin release for exercise is protective, right? And so I think there's a lot of benefits for running, either kind of during, like before pregnancy, but also during. But the biggest recommendation by the American College of Gynecological Physicians is that they're looking for runners to start to decrease their intensity of running, but within what makes sense for them. And so I think we just have to watch for major risk factors of things that we're concerned about within women. And then also, you know, making sure that women are gaining weight. And I know that there was a question that James had said somebody had sent out about like what is appropriate weight gain per week. And I can't find any statistics that's per week. And there might be something out there, I just can't find it. So that would be a better question for gynecologists and obstetricians. Most of the time what I was hearing was that, you know, they were kind of asking for kind of a certain gain within the 1st trimester, the 2nd trimester, and the 3rd trimester. And a lot of that is based on what your pre-pregnancy weight was. And so there's some pretty big ranges. And for better or worse, I think a lot of that ranges, you know, depending on the obstetrician too, right? So the last I had looked, they were kind of recommending like 25 to 30 pound weight gain for pregnancy. But with my first pregnancy, like I only gained 18 pounds, and I remember my mom harping me on it. And my OB was not remotely concerned in any way. And this 18-pound gain was after I tanked 9 pounds in my first trimester. So I gained back those 9, and then I only gained 18 past that. But my daughter was like 7 pounds or 6 pounds and change, and she was totally healthy. And I was super active during all of this. They don't necessarily think that the weight gain has like huge indications about like health and safety. It's more about how your uterus is growing, and so they're basing that off of measurements that they're doing during the OB visits.
Yeah, super cool. I mean, definitely a lot of information I had no idea about. Are there any like kind of common injuries or aches and pains reports that you generally see from people, or anything that Lauren or Rachel, you yourselves experienced during your pregnancies that that people can kind of get an idea about?
So I actually can't hear Lauren, so I don't want to like talk.
Yeah, you can go. I kind of figured I might have to say Rachel go first.
Yeah. Anyway, so I don't know if she's trying to talk or
No, you're good.
Okay, I'm good. Yeah, I had like 2 kind of minor injuries, I guess, during pregnancy so far. Around 21 weeks, I was doing like what was a moderate paced workout for me. And it was just kind of like a sign that it was too much for my body at that point. Like a week earlier at 20 weeks, I was able to handle that, and then suddenly at 21 I wasn't. And so after a workout at what was well slower than my marathon pace, I think it was a 10-mile run. I got back, or 10 or 12-mile run, and my just like my pelvic bone or the ligaments on my pelvis were really sore, and I had like some trouble walking for a couple days, and then took 4 days off of running, and then got back into running pretty quickly after. So that was pretty minor. It was just like maybe a strained ligament around my pelvis. And then around 28, 29 weeks is when I felt like some SI joint pain in my lower back. And that was pretty severe for about 2 weeks, where I had difficulty walking without pain. And that was pretty sudden and didn't seem to be caused by running necessarily. So it could have been like the position of the baby. I'm really not sure, because it kind of came out of nowhere. And then that's when I started seeing Erica for PT, and then probably like another week and a half of doing exercises before I could like walk and start running again comfortably. So it actually worked pretty quickly, and the pain eventually subsided. But at that point I had missed 3+ weeks of running, so it was pretty hard to get back into it.
Yeah, for sure. How about you, Lauren? Anything in that?
I had occasionally early on, when I was doing more of the longer runs, I kind of stopped after like 20 weeks. I didn't do much longer than like, I think it was maybe a couple like 10 or 12-mile runs. But after longer runs, I would sometimes have some pelvic pain, like especially at nighttime, maybe because I was like stiffer. Like I would remember rolling over and being like, oh, that hurts. And then like randomly my calves would just like hurt sometimes, even though I wasn't doing anything very difficult, or like I never really did workouts or did anything very hard. Like sometimes I would just go out and be like, my calves feel like I did a track workout yesterday. And I guess it's just because it's like the workout of carting the belly around. I don't know. But I was curious about PT's like, oh, sorry, perspective on that. Is like, did that just happen sometimes because your body's doing more of a workout just on an easy run? But those were really the only things that I had come up, were just those occasional like knots in my calves and the pelvis.
And is that pretty like normal, like reporting that you would hear normally, Erica?
Yeah, for sure. And the calf stuff really, So the interesting thing is that the calves are a huge postural muscle, and they do a lot to counterbalance our trunk. We don't think that much about it, but it's certainly possible that the counterbalancing that was happening in regard to your belly was causing the calves to tighten up. And then with the increase in relaxin, it throws our balance off, and so our calves have to work harder for balance and stability.
Interesting. Okay, that makes sense.
Are there any sorts of like red flags or anything? Like these sound like things again that even like not being a pelvic floor physical therapist, I occasionally will get a pregnant patient who comes in with these sorts of reports, but are there any things where like as a patient or as a clinician, like we should be considering kind of referring them out?
Yeah, so there's a handful of kind of big things, and some of them would be like, oh yeah, that makes sense. So obviously if somebody's like having like spotting bleeding is relatively normal, but if there's like significant like bleeding from the vagina, then that's definitely something to talk about. Even spotting, I usually encourage people just to touch base with their OB and just say, hey, I'm having some spotting, I just want to let you know, because then the OB remembers to kind of touch base with them. Like shortness of breath during exercise, chest pain, like dizziness and faintness is a common thing during the pregnancy, but certainly if it seems to be on the extreme side or if it seems to be escalating for people, that's something to be concerned about. If they're having headaches, and again, some people have pregnancy headaches, but if they seem to be kind of escalating for some reason, that's concerning. Like significant muscle weakness, calf pain, so not the tightness, but like calf pain and swelling. So we get more concerned about like DVTs. If they're having kind of like regular kind of significant contractions in their abdominal wall related to the uterus. A lot of women would describe it as like a lot of kind of like belly tightness. Like it feels like kind of their whole belly gets hard and it doesn't release. And that seems to be on a regular basis. If it's early in their pregnancy, they might not necessarily associate it with Braxton Hicks contractions, but that's something to watch if they're getting a lot of kind of like belly tightness and they're having a lot of difficulty moving. That's abnormal. And then flushing or gushing of fluid coming out of the vagina, which is a huge sign that their water is broken. Like that's concerning too.
Yeah, absolutely. I guess like, and then similarly, like when should people be seeking like the help from a pelvic floor physical therapist? Like even, outside of all of that kind of stuff.
Yeah, so I certainly encourage people to touch base with a pelvic floor physical therapist. If they're having any aches and pains during pregnancy that limit their ability to function in the way that they want. And so for, a lot of people, they report their aches and pains to their OB, and the OB says, oh yeah, like you're pregnant, of course you're like walking and dragging your leg, that's normal. And I get concerned about how much the like normal pregnancy symptoms get sloughed off, and for some of it is that OBs don't realize that we can help their patients. But really, if there's anything that's causing them a limitation in their daily life, I think it's important for them to touch base with a PT. And specifically like a PT who has a pelvic health or a background in working with patients that are pregnant. I've treated a lot of patients postpartum who went to a regular outpatient PT clinic and they were told to come back after they were done with their pregnancy because they just didn't know how to treat them. And so unfortunately, there's a lot of PTs who just don't know how to treat patients who are pregnant. So I would say either a women's health PT or somebody who works in a clinic where there is a women's health PT who can kind of like help guide the physical therapist on how to triage stuff.
Let me just see if there's any questions or anything that came through. It doesn't. Okay. I guess just for like for postpartum considerations, are there anything like either Rachel or Lauren have experience or anything, Erica, we can obviously go into what like your general recommendations are for kind of returning to running postpartum.
Do you want to go first, Lauren?
Well, I just would be very curious for your advice of how to get started. I haven't done anything yet. I've like barely walked outside the house at this point. But I was thinking of starting at least by going for some walks. I'm hoping I can figure that out. Like now that she's a little bit big enough to put in the carrier, I wanted to do that. And then I was hoping like to be able to start doing some running at 6 weeks, but I have no idea what to expect as far as how I'll feel. So I talked to a friend who said that she thought she would feel like so much better, like walking around. I'm like, oh, I feel so much lighter. Like I feel like it's going to feel good to run again. But she said she felt a lot worse than she did at the end of her pregnancy. So I've been like trying to kind of warn myself that it could be kind of ugly when I start up again. I just am curious for your advice of like how you would do that. If you, I guess I was maybe thinking too, I would probably do like walk running for a little bit. I don't know what you think is the easiest way to get back in, because I'm really, really eager to. I miss it so much.
Yeah, so I would initially start with running. And then the other thing that you're missing in all of that is to remember that you don't have the relaxing happening, but I'm assuming you're nursing, yeah?
Yeah.
Yeah, so if you're nursing, then your ligaments are still loosey-goosey for the entirety that you are nursing, and so is your connective tissue. And so that's just something to be mindful of. I applaud women who nurse, like I nurse, and I also understand that for a lot of women, they're not able to, so that's okay too. But just to realize how that impacts your nursing, or how it impacts like your hormones and your tissue. So the other thing that you want to do with the walking to prepare for running is to start with a strengthening program. And so, working on gently finding your abdominal muscles again, and some kind of like that, and that can be difficult. So having a physical therapist either talk you through it or walk you through it in a clinic can be a big help to have visual imagery and kind of to be able to feel your belly and understand how to find those muscles again. And then to work on hip strengthening things, kind of like band walks laterally and monster walks, which hopefully you've done in the past.
Julianne showed me how. Yeah.
And then like single leg balance stuff. So like a vast majority of running is alternating single leg balance. And so we want to make sure that your single leg balance is solid, doing like progressive lunges, with a short distance down at first and then slowly increasing that distance. Squats without lifting at first, just kind of like squatting down to a chair and standing back up. And then also working on upper body strength. So working on scapular retraction, so doing rows and that kind of thing for upper body stabilization with running, working on gentle trunk rotation and figuring that out again, because it's very different after your rib cage is lifted after a baby. So your ribs are way jacked up in the air. We got to kind of bring them back down and figure out how to rotate normally. So going through that kind of stuff. And then, yes, eventually working through like some walk run stuff for sure.
Okay. That's really helpful. Thank you.
You're welcome.
Tomorrow.
That's what we like to hear. So for Rachel and for Lauren, so Rachel, you can go first just because I know you can't hear Lauren, but one of the questions we got from the audience was, do you see yourselves as role models or trailblazers having run pregnant in the trials? And commented, I think you were both total rock stars.
Oh.
I mean, like if someone saw us running and felt like we could be a role model for them, I think that's awesome. Like if someone felt empowered, like, wow, I can, keep running or keep doing whatever it is that I love, like while being pregnant. And so in that way, sure. But I don't think like that was necessarily the intention, that like we are the model to follow, like running at this point in our pregnancies. And like at 33 weeks I couldn't run because my back was hurting, and Lauren was able to run 8 miles around 8-minute pace at the trials, and like for me personally I wouldn't have been able to do that just a few weeks later. And so I still think it's super empowering that she did that, but like I think it's so different for everyone, and it's so different for every pregnancy too. So
yeah, I really like what Rachel said, that I mean that's just amazing to think. I'm like, it's very touching to think that other people could think that way, and we weren't necessarily doing the trials for that reason. We thought, I mean, there was part of us that was like, oh, we qualified, like we can do this. and we think it's okay that we're doing this, and we were encouraged by our family and friends around us to do it. So in that sense, I guess we're thinking about that, but mostly I like what Rachel said about how hopefully that people are getting the idea that like you should be able to do whatever you would like whatever feels most comfortable to you at that time, or like depending on how your body feels, what you're like maybe like mentally comfortable with also. Because I think that was, for me, was part of like how I felt about running. I just didn't really ever want to push myself during pregnancy. And I think some people have like more of a comfort level with that than others. But yeah, so we didn't necessarily think of it that way, but it's really wonderful to feel that maybe others might see it that way or be encouraged to run later in their pregnancies if they would like to, and something that they're excited about. Yeah.
Yeah, absolutely. No, it's cool to see like just more and more, again, positive stories about just, how, you can maintain a safe, healthy lifestyle potentially, as long as things are going well, like you can
Right.
continue to do things and participate in pregnancy, because obviously that's not always been the case as far as how people perceive pregnancy.
That is true. I think that was something Rachel and I were talking about too. I feel like it's even changed like in the last 4 years or 10 years, like the perception of people in general in the public of how they see pregnant runners. Like when I run around my neighborhood, my neighbors would like smile and give me a thumbs up. And I wonder if even 10 years ago that would be the case. So I do feel like it's changed rather rapidly. And probably that is from like very high profile people like Alicia and Montano, who were running in very public places and in national championships. Very pregnant.
Yeah, for sure. I don't know if you guys have any other questions for each other or for Erica, or if any other audience questions roll in, but yeah, floor is kind of yours from here. That was all Kim had for questions.
It looks like there's a question that popped up from somebody. So somebody by the name of Megan says, how do you know when to taper mileage? I already have gone down from 60 to 70 miles per week in my second trimester to closer to 40 to 50. And now in the third trimester, I'm 30.2 weeks now. Still feeling good, 7 to 11 miles a few days a week, and longer 12 to 14 mile long runs once a week, but beginning to wonder if I'm doing any damage that I'm not feeling, or I should par down. So I'll start to answer this, and then if you guys have anything to add, you're welcome to. So Megan, my number one concern that we don't always pay attention to as women, or don't know to look for, and my biggest concern as a pelvic health physical therapist is if you're feeling any like vaginal pressure or vaginal heaviness, that can be your pelvic organ shifting downward. And it's concerning because that can have long-term ramifications. And so we just want to be careful about that, because unfortunately, like our kind of best like procedures to like completely fix those is surgery long range, but pelvic floor physical therapy can be really helpful for that. But just kind of the repeated pounding, unfortunately, during pregnancy can really increase the risk for that. That's not saying that that's going on for you or that that's going on for any elite runners, but just to be listening for that message. And if you're feeling that sensation, that's your body saying, hey, I need you to back off. That's not saying, oh, the damage is like massively done and it can't kind of like retreat after pregnancy, but I just think something to watch for. And then also working closely with your OB, and having an OB that's supportive of runners. I think, that's a hard thing that a lot of elite athletes struggle with, is that they are participating in a sport or something. And there's a fine line in having an OB who is educated on how to guide athletes. So I was dancing professionally with 2 of my pregnancies, and my OB was amazing in supporting my career and kind of guiding me on how to taper and guiding me on how to protect my body, and watch for safety stuff. And so I am forever grateful for her support and her guidance in that. So I think that's an important thing, is finding a doc who is a good supporter of you, who's well educated, but can also guide you on how to protect your body. And then the other things, to be mindful of is like, can you run? It's like the walk and talk test, right? Like, can you run and can you carry a conversation? I'm assuming that if you're running that much that you have a heart rate monitor and that you're monitoring your heart rate and that it's within a safe level for you. And if you're not sure of that, then to work with a physical therapist or an exercise physiologist to kind of know what your target heart rate is, and to avoid, levels that are a little too high in terms of the safety for the baby. And then also, being cautious about making sure that your uterus is growing appropriately. So there's not a huge guidance on like number of weight gain, but it's that your uterus is growing within the right centimeter, or I think it's centimeter range per week of pregnancy, so that they are making sure that the baby is growing and that also you're having regular baby movement. And if there's concerns about that, to be checking with the OB. That's all of it. Do you guys have other thoughts or information?
I would just add that, like, if you're an experienced runner, which it sounds like this person is, then a lot of it's pretty intuitive. Mm-hmm. Like that, all right, now I'm in the 3rd trimester and gaining more weight and things feel less comfortable, so I'm going to do less, but like that less could be different for everyone. Yeah. I'm like grateful that during my pregnancy it's been pretty, like, my body's just sent signals that, okay, I'm not gonna run today, or okay, today I'm gonna run 5 minutes and then walk for 2 minutes, or like it's totally just depends on the day and whatever I feel like. So like really being in tune with those signals and not running past like what's enjoyable or feels comfortable.
Mm-hmm. Yeah, I completely agree with that. I feel like this person must be a very experienced runner, so already has a very good feel for their body and like how to listen to it, and continuing that is probably one of the biggest things for pregnant running. I was curious about something that you said, Erica, about you had an OB that was like able to kind of guide you with like tapering across like the end of your pregnancy. That was something that I probably should have, like, my doctors were all like, oh yeah, you can totally run. They said what you said, like, just make sure you're able to talk. But I never really talked to them about like the specifics of how much I was running or anything, because I thought, I don't know, I didn't know what they would make of it, I guess. But maybe I should have now. I just didn't think that they would be able, I guess, necessarily to provide guidance on like specific amounts of mileage and like what was okay or not. But maybe I should have. Like, did you have a very explicit conversation with your doctor about that?
Oh, yeah. So, I mean, when I went in for my first visit at 6 to 8 weeks, and it was probably like my husband elbowing me in the rib cage a little bit. But I said to her, look, I dance professionally and this is what I'm doing. And this is the kind of stuff that I'm doing. The stuff that we're doing is very athletic. I have a duet with a male partner who's literally like throwing me up in the air and like throwing me across the stage. And we're up against each other's bodies, and I'm dancing with other dancers as well. And I need guidance on how to manage this and at what point it's like safe or not safe. And so she gave me pretty clear guidelines on like what she was comfortable with. And then if there was something I disagreed with, like, she was great about having open conversations about kind of like triaging it and working through stuff with me. And so I think for me, it was important to have open conversations as much as like I was like, hey, this is my birth plan. Like, this is the rest of my life until I deliver this child. And I really, I feel very lucky because this is an OB who I've worked with professionally for years. So I was very careful on picking her because of how she delivers babies and how she works as a physician, but she's a huge team player. And so I feel like we already had like a working relationship anyway, but, and so I trust her, and I trust her opinion, and I trust, some of the information she has. And I also knew that if she didn't have a good answer, she was going to research it. And sometimes that was the case. I was, asked her a question and she'd say, Erica, I don't have the answer for that, but I'm going to look into it and I'll get back to you. And so, I think that's an important thing to realize, is that a lot of these docs are very open to working as a team. And for me, that was important. It's not for everybody. They just want the doc to tell them what to do, and they just follow, toe the line, and that's totally fine. But for me, I wanted somebody who was going to listen to what I wanted, but also be like, no, Erica, this has to get shut down today, or this has to get shut down next week because of X, Y, and Z. But she had clear reason for it, and so I respected that.
Yeah, I think that would be really valuable too. And hopefully the person who wrote in, Megan, maybe has a doctor. I'd imagine in the Boston area, there's a lot of runner doctors, runner OBs that would be able to weigh in on that and have looked at the research, and could be really useful and valuable in that way.
I would hope so, but I don't know.
Yeah, if we find them, look at it.
We're getting another question. Are you guys seeing this one from Amanda?
Yep, on the side here.
Yeah, so she says, I'm currently 16 weeks postpartum and have had some pain in the left front of my pelvic joint. It's not always there, and it's painful when I'm trying to sleep after longer runs or faster runs. This has occurred since I was about 6 weeks pregnant. Is there something specific I should be doing to prevent this? So not to be vague, Amanda, but the left front of your pelvic joint. Oh no, you were pretty clear. I'm guessing it's possible that this could be pubic symphysis pain, and it may be possible that, especially since it's intermittent, that the pain is related to kind of how the pelvis is tracking. But to be honest, without looking at your pelvis, it's hard to know for sure what the driver is on this. So I think seeing a pelvic health physical therapist for an evaluation, either via telehealth, because sometimes we can kind of see the mechanics through the video camera and the telehealth visit, or seeing them hands-on, depending on where you're located and if there's somebody available to see you, could really help triage what's causing it and then give you specific exercises as to what is driving this for you. Hopefully that's helpful.
I got a question through text. Is it normal to pee yourself when you run while pregnant and after?
It's common. It's very common, and it's normal, but it's not something that you should have to suffer with. And so this is a very common topic. And I think postpartum is a kind of a vague thing. And so a lot of us think as postpartum as like, oh, I just had a baby in the last year. And postpartum for me falls under the umbrella of you have had a baby at some point. And so I have women who come in to see me and they are, I don't know, 10, 15, 25 years past their baby. And they're like, well, I'm no longer postpartum. But they're still leaking, and they were leaking during their pregnancy. And so I think the important thing to realize is that if this is happening, then it's something that we should work on. And so incontinence during pregnancy, postpartum, or with running is common. We have teenagers who have not had children and they struggle with urinary leakage, which is called stress incontinence. And so all of that is often either fixable completely or massively improved with either pelvic health physical therapy or some sort of guidance on core stabilization and that kind of thing. And just to realize not all of it's driven by the pelvic floor. So for a lot of people, we find that they have right-sided glute weakness. And that if we fix that, their pelvis is better stabilized, which means their bladder is better supported and they no longer leak. For some people, they are not breathing properly and they're doing funny things with their diaphragm, and that is driving increased force into the bladder, and that's causing the leakage. The pelvic floor itself is fine. So the whole theory on like Kegel until the cows come home to fix your stress incontinence is not a good remedy. So having somebody look at your body and figure out why you're leaking is the most important thing, because it's not always the same thing for everybody.
I feel like I never would have thought of like some of that stuff for sure.
Yeah, nobody does.
No, 1,000%. So I haven't seen any new questions roll in or anything. So if you guys have any like closing thoughts or anything that you would want to impart on the viewers, we can start with Rachel and work our way around.
Yeah, I mean, like I said already, I just think it's so individual, and like from anything from like what can I do beforehand or during pregnancy or postpartum to like how much weight should I gain during pregnancy. Like it's just so individual. And you know, like Erica said, she had lost weight in her first trimester. Like if you have morning sickness or if you don't, like it's just so, and oftentimes like pain that you might have during pregnancy has nothing to do with like what you did or didn't do with strength. And I think like at first when I had aches and pains or injuries in pregnancy, I felt like, well, this is my fault. Like, what did I not do? Or what should I have done? And like, maybe for some people that's true, that like a lot of aches and pains are preventable, but I think that also it's like a misconception that everyone is. And like Erica was saying, like the hormones can spike at different times for different people and the baby can be in different positions. So just like having grace and patience with yourself and accepting like that anything can really happen, and not, I think it's been like a good lesson not to be too hard on myself during this time.
Mm-hmm.
Definitely. Lauren, anything for?
Similarly, I guess one thing that I kind of didn't say is I feel like I've talked a lot about all the things that were like bothering me, but I guess I just want to say there was a lot of things I really loved about running pregnant too. And maybe you all felt that way also. Like I felt like I was bonding with the baby, like, and I loved the feeling. Sometimes it was hard for me to get out towards the end where I'd be like, this, I didn't like feel like that effortless, weightless feeling that you can get on some runs when you're not pregnant, but I would feel like really empowered afterwards. Like, oh, I still ran 5 miles. Like I'm pumped about that. Like it felt good. And like, I don't know. There was a lot that I really loved about it. Maybe it's easy for me to say that now that it's over and to be like, oh, I miss pregnant running. But there was a lot of joy, I think, from it. And then kind of what Rachel was saying towards the end too, the fact that like there's no, all the pressure is off. Like I didn't do any races like seriously in any way. And I just enjoyed it in a way that I think before I was pregnant, I was like getting like really serious and like kind of uptight about some of my races and the way that was taking the fun out of it for me. And this was like really brought me back in a way of like what I really loved about running. And just like thinking about like this big change was impending in my life and like how I felt about that. I just wanted to say, I think there was a lot of enjoyable parts of it too. I was glad to be able to run throughout it.
Yeah, that's great. And then I don't know if you have any closing thoughts, Erica.
Yeah, I think one of the best things that Rachel and Lauren touched on in speaking was that there are so many things that are variable in pregnancy, and it can be variable from person to person, and from different parts of your pregnancy and from pregnancy to pregnancy. I mean, after having 2 kids, my pregnancies were night and day from each other. And so, I think that's an important thing to remember is it's not always about like what you've done or haven't done. It's just a matter of how the pregnancy impacts you. And then also realizing that there are people out there to help you. So just realizing that there are physical therapists that can make a big difference. And there are exercise programs that can be really helpful to allow people to keep running. And the other thing that Lauren and Rachel both touched on was the importance of listening to your own body. So if something, doesn't feel good or doesn't feel right, to listen to that and to guide your running. And you'll kind of hear, like Rachel was talking about, kind of how she kind of waxed and waned and increasing her mileage up and down a bit, depending on how she felt. And I think that was really integral in keeping her healthy and keeping her moving. And that's okay. And being nice to yourself and realizing that that's okay is an important piece of all of this. And the other kind of note that I think I would leave people with is realizing that if somebody is telling you that something is normal and it's a part of pregnancy and you're still left feeling like you're not okay with that, to realize that physical therapists, that patients have direct access to physical therapy. And so, if you're finding that your doctor is not sending you, to really advocate for yourself and ask for a prescription to physical therapy or to touch base with your primary care doc and to reach out for that. And to feel okay about that it's important for you to be able to receive resources if it is helpful for you.
Excellent. Well, thank you all, ladies. This was really cool to listen to, just a bunch of different perspectives and hearing from all you and all your different stories. This video will be posted for people to watch. And if you ever have any specific questions for Erica regarding pelvic floor physical therapy or anything, you can contact her through our website, her email, ericaj@platinumptma.com, or call into our offices to set up an appointment with her. But thank you guys all for being here.
Thank you.
Thank you so much. I learned so much. I appreciate it. Yeah.